Primary care is the jewel in the NHS crown. We all use the NHS, it's our first port of call. Primary care is where most diagnosis and treatment happens, and there's 1 million consultations every day in general practice. So, and we know it's a very high quality service, but it's also a service that's under pressure, and workload is rising, particularly in general practice. The workforce is depleting. I think the nature of care is changing, and patients' needs are changing. Certainly as a GP, I find a large number of my patients coming into consultations have multiple long-term conditions, and so consultations are complex and they're time pressured, and we know there are gaps in what we do inevitably. So we know late diagnosis is a problem. We know that suboptimal treatment happens. So primary and community care really have to evolve if the NHS is to be sustainable, and particularly as we see much more care moving closer to home. Primary care and primary care innovation is very much at the heart of the long-term plan. Firstly, there's a really substantial financial commitment, proportionately much more financial resources going to primary and community care. So I think this will have a real impact on patients as it needs to. I think patients, the public, the community will find that services are much more joined up, that they're much more accessible, that people can get to see the right person that they need to see at the right time, that people will find they get their illnesses, their conditions diagnosed earlier and treated more effectively. We know that's where the gaps lie, and that's what this reorganisation and people working together is intended to deliver. Well, we need innovation to address challenges that are structural and systemic. These are about big barriers that prevent us doing things differently in primary care. We're not going to do better just by doing more of the same. We absolutely have to do things differently, and so that's going to mean innovation in technology, of course, but innovation in systems, in pathways, in models of care, the way services are delivered to and used by individual patients. So absolutely it has to be about innovation rather than doing more of the same. Everyone here will know that innovation isn't something that travels fast in the NHS. It can take years for great ideas to become implemented at scale. So that's exactly what the NIA programme is there to try and address. And I guess it does this by spotting solutions to knotty problems, sharing real-world knowledge about how to make change happen, how to get solutions implemented at scale, and making connections, unlocking the national barriers to spread and adoption. I think so far, as of January this year, around 1,700 additional NHS sites are using NIA innovations, and about £80 million additional has been raised in external funding. So really successful programme so far, and key to driving implementation of innovation in the NHS. Absolute congratulations to the fellows. I'm sure they'll really enjoy their time with NIA as previous fellows have, and I'm sure they'll learn a lot, and they will feel connected and they'll feel supported to deliver their innovations. And I've no doubt that in the not too distant future we'll see their innovations reaching the parts of the NHS that other innovations would just die for.